All of Us is a research program based on precision medicine. It gathers data from different people to help develop treatments that are more complex and suited to each patient, therefore personalizing it. The way that it works is participants would share their health data online, where all their data will be protected. Privacy was an issue that past articles that we've read in class have deemed an issue, but in All of Us, personal information is removed and protected. Researchers would then study the data so that they can analyze the patterns. In addition, the data provided will be sent back to the participants so that they can learn more about their own health. Because every person is unique, treatments for each individual should be distinct and catered to their specific needs. In order to do this, different types of people need to get involved so that data can show more precise patterns. I feel like since All of Us wants all types of people to get involved, it would reflect diversity, which would be good for this kind of research.
Hello everybody, my name is Maha and I will be going over the All of Us research program and what it does. The mission statement of the All of Us research program is that they want to speed up health research and medical breakthroughs, which requires the help of 1 million people to help create individualized prevention, treatment, and care. The All of Us research program aims to establish a research community that can share their health data and therefore help better medical research. The health information gathered from participants is then stored in a database that approved researchers can access and then analyze and interpret. This program is a part of the Precision Medicine Initiative, an initiative that focuses on medicine on the individual level to effectively help people stay healthy and find the right treatments for each person. The All of Us research program is a step towards more inclusive medicine and is an attempt to advance the progression of medical research.
The All of Us project has successfully enrolled 230,000 people with the goal of enrolling over 1 million. From those who are enrolled, 80% are from historically underrepresented groups in biomedical research. The initial data was already released and the program is now preparing for demonstration projects to assess the usefulness and validity of the data. In addition, there are plans to expand the amount of data collected. Success requires continued enrollment, retention of participants, and the retention of trust. I think this project is important for the potential future of medicine. I'm interested in seeing the results of the demonstrations. One reason this project is important is the relatively recent acceptance that gender affects medical research. Most research has been conducted on males with the assumption that men and women are generally the same. After some medications were shown to cause an overdose in women with the same dosage used by unaffected men, it's clear that research needs to improve its diversity.
This is Patricia from Group 19, and today I'm going to talk about my All of Us research experience as a volunteer. So I've personally had experience volunteering as an All of Us research program assistant, where I work closely with the participant, the nurses, and the head of the research program. I specifically volunteered in the Santa Ana Family Health Center, where I recruited participants and helped them fill out the online questionnaires. From my experience, I think the All of Us project demonstrates how precision medicine is developing as many of the participants recruited in the Santa Ana Family Health Center were Hispanics or Latinx, which is a minority and underrepresented group in America. Some of the challenges faced by many of the participants, however, is the lack of understanding English. I think the option to fill the questionnaire in Spanish is really helpful, and more language option will potentially help other minority groups as well. As the number of participants recruited in the program continues to increase, the advancement in precision medicine will also continue forward, especially among minority. Thank you.
Hello, my name is Ali and I'll be talking about the Careful Devices Manifesto. So first off, I want to say what a careful device is defined as, and that is a healthcare tech that combines personal self-tracking with the knowledge of a health practitioner. So essentially you have an application in your phone that does what your provider would do. So it's very convenient for the user. And one app in particular I want to talk about would be Ovum. Ovum is a self-tracking fertility software, and that one tells a woman, it tracks their menstrual cycle, and it tells the woman when they're fertile and when they're not fertile, so they can plan pregnancies. And that would be very beneficial because so none of them could be unplanned, or they're trying to get a kid and they can't get a kid. And this is something that would have been beneficial for my family because we were trying to plan a whole family, but it didn't really work out the way we intended, and multiple tries were needed. So this would have been very helpful in speeding up that process and making sure that we didn't get depressed whenever something didn't happen.